Hi, welcome to this presentation on endometriosis. My name is Dr. Christine Matheson, naturopathic doctor, and this presentation is specifically for health professionals because I'm going to be talking about clinical insights on evidence-based nutritional and herbal supplements for endometriosis as one component of a complete approach that you may be creating a protocol you may be creating for a patient with endometriosis. So I just wanted to start by saying that this is one component, I think a really valuable component to be aware of because there's really important studies and important research on specific nutrients and specific herbs. I do feel that endometriosis deserves more funding and more research, and I'm here because I want to be part of that conversation, talking more about endometriosis. I do feel that many of my patients who are dealing with endometriosis had a long journey to get a proper diagnosis. So I'm going to comment briefly on that in my presentation. But the focus today will be about how I can help you as a health professional have more strategies and more tools in your toolkit to offer to your patients with endometriosis. So let's get started. All right. Clinical insights on evidence-based nutritional and herbal supplements for endometriosis with me, Dr. Christine Matheson, naturopathic doctor. Who am I? I am a naturopathic doctor, licensed naturopathic doctor in Ontario, Canada, practicing since 2001 with a commitment to women's digestive, pelvic, and gynecological health specifically. And I'm honored to have been one of the first naturopathic doctors in Canada to work in a hospital setting at the former Multidisciplinary Women's Pelvic Health Center at Women's College Hospital in Toronto with Dr. Kai Lee, who pioneered the use of minimally invasive laparoscopic surgery for gynecology in Canada. So I'm super grateful that I had the opportunity to collaborate with him, specifically on providing integrative care to women with endometriosis. He believed in a multifaceted medical approach for endometriosis and regularly guided his patients on nutritional strategies. So it was a real honor to be able to work alongside him through that journey. So in addition to my private practice and seeing patients, I also do create educational content for a supplement company as well. So, what is endometriosis? It's a chronic, often painful condition where tissue similar to the endometrium, the lining of the uterus, grows outside of the uterus. And these endometrial like cells can implant on the ovaries, fallopian tubes, bowel, any tissues lining the pelvis, as well as any other organ. We believe now, leading to inflammation, scarring, and adhesions. And the pain may intensify around menstruation and can persist beyond the menstrual period. It affects about 10% of people with female reproductive anatomy globally, typically appearing in individuals between age 25 and 35. Key symptoms can include pelvic pain, especially before and during menstruation, pain during intercourse, painful bowel movements or urination, often worse, especially during menstruation, heavy or irregular menstrual bleeding, fatigue, bloating, and nausea. And of course, every patient's going to present slightly differently. And I think what's important is, really helping a patient properly get it diagnosed if they're experiencing any of these symptoms, and then being able to target a protocol and a plan for them around that. The pathogenesis of endometriosis is still poorly understood, but the theories of potential causes include a retrograde menstruation, where menstrual blood flows backwards through the fallopian tubes in the pelvic cavity. So that's one theory. The genetic predisposition is another. People with a family history may be more likely to develop it. Immune dysfunction and altered immune response may fail to clear menstrual tissue from the pelvic area effectively. Inflammation and estrogen dependence. So endometrial-like cells are responsive to estrogen, which can promote their growth and associated inflammation in the pelvis. I've even heard new theories that there's a connective tissue link as well. It could be a connective tissue disorder. So there's still exploration onto the underlying causes. I did want to share with you the importance of improved diagnostic process via more accurate ultrasound methods for endometriosis. And I actually live in the same province as where Dr. Matthew Leonardi is based out of McMaster University, where he has done incredible research and published this information about getting more accurate about the ultrasound to properly diagnose endometriosis. So I would highly suggest as a health professional that you explore that information. It may be very helpful to you to learn more about that and help your patients get proper diagnosis. The clinical strategies that you're going to be wanting to think about and that you probably already do as a health professional is that you're going to want to support healthy hormone metabolism and make sure they're metabolizing the hormones effectively, provide anti-inflammatory, antioxidant support overall reproductive health and a regular menstrual cycle, and support the health and function of endometrial tissue for overall uterine wellness. So the key nutrients and herbs to consider that I want to share with you, and that I will share some of the research around. Obviously, there's more. I couldn't share it every single reference here, but I'll cite some studies and some interesting research on each. So nutrients would be magnesium, N-acetylcysteine, vitamin D3, vitamin C and E. And the herbs and plants to consider would be ginger extract, dim, PEA, and polydatin, and ashwagandha. All right. So the importance first, it's always important to say, of sourcing high quality supplements. So I'm really encouraging you whenever you're going to explore supplements to look for supplements that are clean and pure, filler free, non-GMO, CGMP, certified lab and suppliers, prioritizing whole food ingredients, meeting or exceeding FDA and Health Canada safety standards, allergen free, because that could be potentially a trigger for an individual, gluten, dairy, nuts, soy, free of those, and evidence-based. So clinically researched ingredients with high bioavailability, high extract ratios, and a third-party testing tested for purity and potency. Very important criteria to look for in any supplement. So let's dive into magnesium. It has long been used in gynecology for conditions like premenstrual syndrome and endometriosis because it helps relax the smooth muscles, potentially reducing retrograde menstruation, a key factor in endometriosis. So based on the research, animal studies show that magnesium supplementation reduces vascular endothelial growth factor, which may inhibit the angiogenesis and endometriotic lesions. So that's very important to be aware of. So we definitely want to explore the use of magnesium and acetylcysteine as a precursor to glutathione. It's a powerful antioxidant. NAC helps neutralize reactive oxygen species in the pelvic cavity, reducing inflammation, cyst growth, and pain in endometriosis. So this study was interesting. A study on oral NAC for 3 months showed significant improvements in pain scores, and those would be related to dysmenorrhea, dyspareunia, and chronic pelvic pain. Also endometrioma size and CA-125 serum levels. And also another point, NSAID use also decreased, and among 52 women with reproductive desire, 39 successfully achieved pregnancy. So that's really important because that is a big concern for many patients with endometriosis, whether they will be able to conceive and achieve pregnancy. Vitamin D3 modulates inflammation and proliferation and endometriotic cells, and a lower vitamin D status is associated with endometriosis. So we really want to bring those levels up. A meta-analysis of 9 studies found that women with endometriosis had significantly lower vitamin D levels compared to controls, and lower vitamin D levels were linked to more severe stages of the condition. So a prospective cohort study found that women in the highest quintile of predicted vitamin D had a 24% lower risk of endometriosis compared to those in the lowest quintile. So I think, again, super important to be aware of. We all think of vitamin D for various things, the immune system and for bone health, but really important here to think about it for endometriosis as well. Vitamin C and E in endometriosis, elevated oxidative stress in the peritoneal cavity contributes to inflammation, pain, and cellular damage. So these antioxidants help neutralize free radicals, reducing inflammatory markers, and alleviating symptoms such as chronic pelvic pain and menstrual discomfort. So, an example of one of the clinical studies I found a trial shows significant reductions in pain and oxidative stress markers, MDA and ROS, after 8 weeks of supplementation. So, again, really worth noting more research around this, but wanted to just highlight that. So, just adding in that vitamin C and E can make a real difference. Ginger extract, one of my favorite herbs, has been traditionally used for multiple purposes across different cultures, including relieving pain, reducing inflammation, and improving digestion and supporting immune health. Ginger helps to manage primary dysmenorrhea by reducing inflammation and inhibiting pro inflammatory cytokines and prostaglandins. So, multiple studies show that ginger effectively reduces menstrual pain severity, often outperforming a placebo and matching the effectiveness of NSAIDs for its pain relieving effects. So, really worth noting, especially if someone can't take NSAIDs and is looking for an option. So, super important to know that and doesn't come with some of the side effects that we have to be concerned about with the NSAIDs. DIM, which is a phytochemical found in cruciferous vegetables, has been shown to have potential in supporting the metabolism of estrogen and limiting the growth of endometrial like cells. And so we have often heard about the importance of the cruciferous family of vegetables for this reason. And a study investigating the combination of DIM as well as Dienogest, common pharmaceutical treatment for endometriosis, found that DIM enhanced the effects of DNG's effects by reducing cell proliferation and estradiol secretion in endometrial tissue. So that's a great example of an integrative therapy where combination therapy has benefit and it also significantly improved bleeding patterns and reduced pelvic pain compared to GNG alone. Really worth noting. PEA combined with polydatin. So, PEA is a fatty acid like compound found naturally in certain foods and made within the body. It modulates the endocannabinoid system and activates peroxisome proliferator activated receptors and helping to reduce that neuroinflammation and the growth of any endometriotic lesions. Polydatin is a precursor to resveratrol and it has antioxidant and anti-inflammatory effects. So when you put those two together, the studies show the efficacy improves. So there's studies combining these compounds have shown promising results. One is with 30 women found that ultramicronized PEA and co-micronized PEA polydatin improved pain, quality of life, and psychological wellness. And another study of 4 patients just showed significant pain relief and reduced analgesic use with potential improvements in endometriotic lesions. So, again, really promising studies and research to show this direction of combining the polydatin and the PEA for some relief and success for some patients. And finally, ashwagandha as a herb has traditionally been used as an adaptogen to help the body manage stress, anxiety, and fatigue. So, for those with endometriosis, it may offer benefits by addressing both the stress and the inflammation. It helps lower cortisol levels, which can alleviate stress related symptoms, and its anti inflammatory properties may reduce the pain and inflammation associated with endometriosis. So the studies show that ashwagandha root has shown analgesic effects, reducing pain behaviors and hyperalgesia while lowering cytokine levels. So the active compound with theferin A also targets inflammatory pathways and provides additional support for managing the symptoms. So that's a little more of a deep dive into the physiology of how it might work and the reason it might work. So ashwagandha, very helpful and promising to combine that with the others. So a summary of evidence-based nutrients herbs to consider: the magnesium, the NAC, vitamin D3, vitamin C, and vitamin E, and the herbs ginger extract, DIM, PEA with the polydatin, and ashwagandha. And there's more research to explore, but what form can patients take these nutrients and herbs in? These nutrients and herbs can be taken each individually by purchasing multiple bottles of capsules, which can become costly. So, some all in one formulas are designed and exist for endometriosis that contain some or all of these evidence based ingredients in capsule form, making it more affordable and convenient. So, many of my patients do ask for the all-in-one option to make their life and their finances a little simpler as well. So, pro tip again, just to re-emphasize this, remember to always look for higher quality brands too, to make sure there's nothing in the supplement that would irritate or lead to any issues. So, I think it's important to always consider formulations that are designed by respected health practitioners and supplement brands that prioritize third party testing for purity and potency of ingredients with high bioavailability and high extract ratios so that the patient can feel and the impact of the supplement and absorb it and get more out of it. So, effectively supporting endometriosis patients, it can be a long and frustrating journey to get a definitive diagnosis of endometriosis. Some women only get confirmation after an explorative laparoscopic surgery and have been waiting a long time to find strategies to manage their painful symptoms. I think awareness is building about the impact endometriosis can have on the quality of a woman's life while new theories continue to emerge about the pathogenesis. If diagnostic methods gradually improve too, I think this will lead to earlier detection and increased demand for help. And as health professionals, I think being well informed can serve a timely and critical need by offering these evidence based and comprehensive support approaches to patients with endometriosis. So I hope that this was a helpful way for you to feel more well informed about evidence based approaches that you may want to consider for your patients. Be sure to consider the clinically studied nutrients and herbs for endometriosis as one of the key components of a complete clinical approach that you may consider in combination with other valuable interventions such as the dietary support, nervous system regulation techniques, and physical therapies. Like I mentioned, I'm a RVGO practitioner, including some type of physical therapy can be useful too, but really emphasizing the clinically studied nutrients and herbs today and wanting to make sure you know about those. And I really do believe that the more knowledge you have as a health professional, the more that you can support and educate and empower patients, the better we'll all be. So I truly hope that you found this helpful. Thank you for watching till the end. And again, from me, Dr. Christine Matheson, wishing you well. Thank you.